Hey folks, Doug Blake with Body Design University. Welcome to another weekly study. And in this video, what we're going to do is kind of work off of what we did last week. We talked about the three postural distortion syndromes and the overactive, underactive muscles related to them. And I figured I'd just kind of move forward a little bit more. One of the students did mention or ask the question, are those the only things we need to know for this overactive, underactive muscle scenario? And the answer, of course, is no. You do have to know, obviously, through the dynamic movement assessments, the overhead squat, single leg squat, the push and pull. And that's what we're going to talk about today. Is I'm just going to talk about the pushing assessment. Remember, just like with any of the other material, and by the way, if you check the YouTube channel, you'll see there's a video that I did on the overhead squat assessment. So it's not like I haven't done it and I'm just moving past it. No, I did a fairly in-depth explanation once again. Remember the two sides here of the coin that you're navigating when you're studying for your NASM exam. One is you got to pass the exam, so you got to know how to answer questions, and that's just memorization. If you can memorize the overactive, underactive, right? And I think I have a pen here somewhere, right? Pen or pencil. Read, write, recite just over and over, and you'll realize after a while, as you look or you see the questions, given, let me think if I can think of a question, it would sound something like, during the overhead squat assessment, a client displays knee valgus and toes turned out. A probable underactive muscle would be A, this, B, this, C, or D. And there's really only one choice when it comes to the underactive muscle at the LPHC that allows for this adduction movement inward, rotation, and the feet turning out. It's going to be the gluteus maximus, right? Just as a for instance, you would have memorized that because, as many students have noted already, the gluteus maximus is generally always underactive for some strange reason. Well, it's not strange. It's the kind of the nature of the beast when it comes to human posture. We sit down a lot, so the weakening of the gluteus maximus, the weakening of the gluteus medius, yada, yada, yada. You'd memorize all that. You'd look, you'd write it down over and over again. And after a while, you would actually memorize it and it starts to make sense. It really does. So all of that to say, let's push over into funny enough, the pushing assessment. And I wanted to kind of give you an idea of what it looks like. Let me just hit this from the beginning. What this looks like from the perspective of the assessment itself. There are real world implications to this. Now, NASM tells you correctly that you don't have to do an assessment. You can actually incorporate this type of assessment into a workout, just as a for instance. If you're going to do a chest workout, pec workout, and you're doing cables, you can actually just have them do the exercise. You already have your program laid out. We're going to do whatever, 2 sets of 12, 2 sets of 50, whatever the case is. And as they're doing the exercise, you will actually be able to see the issues and problems that they're going through. The corrective component of it, we can talk about at another time. But what I want you to do is, if you have your textbook in front of you, is go to page 395, because that's the pushing assessment movement. The idea is that in any of these scenarios, whether it be for the single leg squat, overhead squat, pushing, pulling, is your main focus from a studying perspective is the tables that say assessment solutions chart. In this case, if you then go to 396, table 12.9 tells you what the solutions are. Now, please don't go there yet, because I want to ask you, I actually want to kind of test you a little bit before we do this. So look, if you've already gone through this chapter, this is a good refresher. If you haven't, put your hand over that, or just don't look at it. And I want to ask you a question. Look at this picture, because I'm taking that on page 396. I'm taking each of those 3 pictures that are in the solutions chart in that table, and I want you to look at them, and I want you to think about it first, because it'll help you to memorize the overactive and underactive muscles. What do you notice? What do you notice first about this individual? Yeah, it's the arch right here, right? What did you already read at the beginning of the chapter? What did you already read about postural distortion syndromes? What did you already read about lower cross syndrome, right? You can go back now and take a look. Well, you already know, if you've already read that and you kind of memorized through it, and this is what I was trying to get at with the one student that made that good comment, which is that once you know those three distortional patterns, it kind of helps you, because now you can look and see that in this case at the LPHC, the lumbopelvic hip complex, the lower back is arched, which means that the pelvis is what? Anteriorly tilted. Okay, well, we already know that the overactive muscles are going to be what? The hip flexors and the lumbar extensors. How do we know that? Because if you go back a couple of pages, you would see that the solutions chart for these other tests that you would have read already, they say the same thing. Anytime there's anterior tilt into the pelvis, it's hip flexors. That's your rectus femoris, which is one of the quadricep muscles. The psoas, iliopsoas, I guess you could. Now they don't have the iliopsoas. That's the iliacus and the psoas muscles. They just put the psoas. TFL, which stands for tensor fascia lata. Okay, it's just a TFL. You don't have to pronounce all three of those words. And then, of course, on the opposite side of the spinal column, hip pelvis area, are the erector spinae or the lumbar extensors. Those guys are overactive. If you're arching up and you're sticking your butt back, and can't you feel your lower back tighten up? Well, if you can feel your lower back tighten up, that means that those guys are shortening. Now, in a case where it's under an assessment scenario, that means that they're overactive. That means they're shortened, they're tightened. That's all it is. And so your hip flexors are what's drawing and pulling the pelvis, right? Pulling the pelvis anteriorly. In this case, you see my finger, that's going the wrong way. Okay, so going this way, right? So here, let me do this, right? Anterior like this. Forget my picture that you got in there. But anterior tilting this way, posterior tilting would be this way. When you kind of arching your lower back and you're sticking your butt back, you're getting an anterior tilt of the pelvis. Those are your overactive muscles. Then what's going to be your underactive muscles? That's why I don't want you to look at this. I want you to think through it. That's what will help you when it comes to test time and memorizing this stuff. What are your underactives? Don't look. Close your eyes and think. If my overactive are hip flexors, my underactive must be hip extensors. Yes, that's kind of the idea. If the flexors are tight, the extensors are underactive. Overactive, underactive on either side of the joint. If the adductor, listen, if the adductor, whatever that is on the body, is overactive, then the abductor is what? Because abduction and adduction are opposite movements. So therefore, one is underactive when the other is overactive, right? So if a muscle is flexing, its antagonistic extensor muscle has to be underactive. In this case, hip flexors, hip extensors. Well, what are your hip extensors? We already said it. Your glutes, your hamstrings in this case, and then, of course, your abdominals. Now, yes, I know it makes it maybe a little bit challenging because she has one foot forward and the other foot back. It doesn't matter, okay? It's the hips that we're looking at, okay? And I know what you're asking. How do I know the TFL? Oh man, it's just too much. No, don't worry about it. Take a look at an anatomy chart. The TFL is just right up on the side, but it actually is slightly anterior on the body. The TFL is generally going to be a flexor when we're talking about sagittal plane movements. But what else does it do? Okay, yes, it's an abductor as well, but that's not of importance here because right now we're simply talking about hip flexion and extension. So underactive muscles, the glutes are simply allowing, this movement of the pelvis, right? This anterior movement of the pelvis, and therefore it is, by the way, your gluteus maximus is a main hip extensor. And if it's weakened and underactive, it's allowing for hip flexion The hamstring complex is the same thing. Your hamstrings are hip extensors. They are knee flexors, but they are hip extensors. So therefore, if the overactive muscles are flexing muscles, the underactive muscles must be extensor muscles. Your glutes and your hams are the main extensors at the hip. Picture number 2, what do we got? This is elevation of the scapula, just shrugging. It's just that I've got my hands out like this, and I'm just shrugging up and down. If you try doing this, if I do this, what muscles am I working? Now I know you're going to say the trapezius, right? Your traps. Yeah, I mean we do shrugs to develop our traps, but there's another muscle in there that you got to keep in mind, and it's pretty easy to remember. And it's actually, I'm not going to say it's a more powerful muscle, but it definitely has a better line of pull, believe it or not, than the upper trapezius. It's called the levator scapula. Elevates the scapula. Just think of it like that. The scapula elevator, the levator scapula, right? So it pulls the scapula upward and allows you to shrug. So when you're doing barbell shrugs or dumbbell shrugs and you're doing this like this, you're building your traps all right, but be very careful because that muscle in there can pull. It really can. I've done it. I've done it way back when. I've done some serious damage to a lot of my muscles from the level of training that I was at, and that was one of them. And that is not fun to pull that muscle. And of course, the upper. Now, remember, it's not the trapezius. You've got to remember it's the upper trapezius. Why? Because the trapezius is very flat and broad, right? So it starts, let me see if I can draw this for you. The trapezius starts up here and actually covers your back. Okay, so there's upper, middle, and lower fibers that have their own actual nervous stimuli to them. Okay, so the upper trapezius can be doing one thing while the same muscle, but the lower fibers of that muscle could be doing the exact opposite. How bizarre is that? It's not. It's mechanics. It makes a lot of sense. It really does. So it's the upper trapezius that are overactive. Now stop just for a second. Think about it. I'm not going to give you the answer yet. You should know this. You should be able to tell me if the elevating muscles, there's 2 basic muscles that elevate the scapula, the upper trapezius, hint, hint, the upper trapezius and the levator scapula. Okay, those guys are elevating. What muscle counters movement upward of the scapula? There's really only one, and it's basically the lower part of the trapezius. Okay, so are there other muscles that, yes, there are. The rhomboids do, but don't worry about the rhomboids. NASM doesn't want you to worry about it, so don't worry about it. That's what you're memorizing. Lower trapezius, upper trapezius. They work, they oppose each other during this elevation movement, just so you get it. They actually oppose each other. So the muscle, one part of the muscle is actually neurologically active in one sense, and the other muscle is also neurologically active, but in an underactive way. Overactive on top, underactive at the bottom. The lower part of the trapezius should be working in sync with the upper to maintain a balanced movement pattern or stabilization of the scapula during pushing movements. Okay, and you'll notice here, look at the difference. See all the space, okay, there, and no space there. This individual is showing clearly a distorted scenario when it comes to doing pushing. You do not want to be doing this while you're pushing. That is it's potentially very dangerous on those, particularly the levator scapula. So let's look at the third picture. Again, if you look at it all on its own, what do you notice? Well, clearly, look at this individual's head in relation to their torso like that. Then look at this individual's head, straight line down like that. And what do you have here? Here you have, and they show it they actually do it for you from there, and then it curves down. So it should be, the head should be obviously back up. Okay, so you see that the question, of course, is what is overactive in this scenario? This can be a little bit confusing, I know, and I actually did a video on this as well. where I basically showed you a picture of the neck so you can see the cervical flexors and extensors. You may want to go back and take a look at that. It's an important one to understand so you know what the overactive and underactive are. Here we go again. The overactive muscles are going to be the levator scapula. In this case, the sternocleidomastoid. That's the muscle that when you turn your head, you can see it right here. Okay. That's that long cord-like muscle that when you turn your head, so that's the sternocleidomastoid, anterior neck muscles. Those guys will actually pull the head, assist in pulling the head forward. Those are overactive. That should not happen. They don't talk about it, but just for fun, just so you know, the scalenes, that's these guys that come out, very flat muscle, they can also be, but don't worry about that so much. Just go by what NASM wants you to know. Levator scapular, sternocleidomastoid, that's your anterior neck. And so again, you just write it over and over and over. And when you do this, you'll notice that these muscles in the front, they tighten up. And that's what you're seeing with, okay, can you see this? I turn my head, this head jutting forward. Now, here's where I know you're going to say, what are you talking about with the underactive muscles? The deep cervical flexors. Well, now, wait a minute. Don't my flexor muscles do this? Well, they do. The reason they're underactive is because they're allowing the head to move upward. See, they're allowing for extension to occur, which assists with the forward movement, jutting forward of the head this way. Hope that makes sense. So the deep cervical flexors, deep neck stabilizer muscles. Let me see if I can help you with that again. I know some of you are looking at me and you're confused. Cervical flexion and extension. Okay, get that? Remember, sagittal plane. Cervical flexion and extension. If my cervical flexors are very tight, they're going to want to pull my chin down. If my cervical flexors, those guys, those deep cervical flexors, if they're weak, if they're underactive, if they're allowing this to happen, right? Well, now watch. See how my head's all the way up here? That's not the way she is, but watch this. Because of my sternocleidomastoid muscles, that's really where you're seeing this. Because of my sternocleidomastoids now pulling forward, now my head's not like this, it's actually like this. I hope that makes sense. Can you see this? Okay, so I've got my underactive, weak cervical flexors that are now this compensation because the sternocleidomastoid muscles are now pulling forward. So now I'm like this. Wow, that hurts just holding it like that. That's why those are underactive. And by the way, you could, again, I don't want to confuse the situation, but technically the cervical extensors would be overactive as well. But you didn't hear me say that, okay? But for this, if you're seeing this on a test, that's what you're seeing. Levator scapula, sternocleidomastoid, deep cervical flexors are allowing for that movement pattern to occur. And there you go. That is your explanation for the pushing assessment. I hope it helps. Remember, we're not talking about whether or not you as a trainer, once you pass your NAT, are going to use this in your programming. Put that out of your mind. That's not what's relevant for you. I will tell you this. If you go through the Body Design University course itself, in the live course, this is where you learn what actually does make sense and what really doesn't make sense depending on your business model that you're going to be using. But from a testing perspective, look, you got to memorize the material, and there's a pretty good amount of it from this chapter on the exam. So memorize that. Just keep in mind that what you do after you pass your NASM exam, that's entirely up to you. If you want to use these, I've known trainers over the years that have absolutely been right on target. They were dealing generally more with athletes and folks that are in really, really good condition. And it becomes actually very helpful and appropriate. But I hope more than anything that this one video clears it up for you on the pushing assessment. Remember, at Body Design University, our goal ultimately is to help you. Look, if you took the test and you didn't pass it the first time, then for sure we want to help you to pass it this next time around. And if this is your first time taking it, then again, for sure we want to make sure that this is the time that you pass it on your first attempt. As always, it's a pleasure bringing the material to you. If you like the content, obviously subscribe to the channel itself. And of course, you can get notifications as well. Leave me any messages, any comments, or any other questions as well from this particular video, because there's a lot that goes to this. And I know that there's probably a number of questions related to the real world scenarios where you would or you probably wouldn't use it. Or if you have anything else you want us to go over at BDU, be more than happy to do that. Have a great weekend, and we'll see you next week.